Good morning. It's been a long and busy, challenging last couple weeks. With the local onset of COVID-19, there's been a lot going on. We've been getting in the police department, and you have been getting a lot of information about COVID-19 from many different places. Earlier this week, I was fortunate to be in a coordination meeting with fire. We were talking about preparations, planning and things for the COVID-19 response. I met Dr. Klassen. He's an EMS, one of the EMS directors with Regions Hospital. And he did a really good job at explaining some basic stuff that's important stuff. And it was funny because when I was talking to him, he had mentioned that he's a former law enforcement, and he was an officer down in Tucson, Arizona. So I thought it would be a good opportunity for us as cops, right, to sit down and talk with Dr. Klassen today. So I asked him to be here today. Good morning.
Good morning. Glad to be here.
Yeah. So appreciate you taking the time. I know you are incredibly busy these days. And I don't want to take a lot of your time, and I don't want to get down in the weeds on a lot of this because I think we do that enough, to be honest with you. I want to kind of stick to the basics, and I want to stick to cops. And talk about, what do we need to know, and what do we need to be doing right now when in reference to COVID-19. So maybe you can just start talking to us about a little bit about the virus and maybe how it's spread.
Absolutely. Thanks for having me here. The disclaimer that I have to start with is that this virus has only existed for a few months, and so we don't know as much about it as we'd like. We're learning a lot, both from studies of the virus and from what we know about coronaviruses in general, coronaviruses being one of the causes of the common cold. But this one seems to be unique, and so not everything we know about common cold viruses can apply to this. But what we do know is that this virus seems to spread by respiratory droplets is what we describe that. And what that means is that as you cough or sneeze, or if you're breathing heavy with some spit in your breath, it can launch these droplets out into the environment. They can get on your hands and on surfaces, and then when you touch your own mucous membranes, eyes, nose, mouth, that's the typical way that it's spread. So because the droplets tend to be too large to float around in the air for any length of time, that's why we differentiate it from infections that we call airborne. And so the particles are big enough that they fall to the ground within a period of time and pretty quickly, and so they can't spread very far. So the biggest risk from this virus spreading is by touching surfaces that are contaminated or being in very close proximity to somebody who's coughing and symptomatic.
So is that where this whole 6-foot kind of rule comes into place? Maybe we can talk about a little bit about the physics, about that 6-foot space that our police department has just been hounding us on. Hey, distance is such a good defense right now.
Absolutely. Distance is the most important way to protect yourself only after hand washing. So staying back from somebody will allow those particles to have the time and distance to fall to the ground rather than land on you. And if somebody were to cough on you and get that on your hands or get that on your uniform or your duty gear, that's the way that you can end up touching your face and then acquiring the virus. And so staying back will help protect you from getting any of that virus on you and get contaminated.
So great time maybe to transition and talk about the PPEs, right?
Yeah.
Personal protection equipment. We got 4 of them.
Yeah.
I'll start with gloves and hand washing.
Yeah. So if I had to pick between hand washing and gloves, to be honest, I would pick hand washing. That's going to be a much more important protection. But the gloves are really helpful, partly because they can be just disposed of and take all the contamination with them, partly because they're a reminder to avoid touching your face. You don't want to touch your face with gloves, and so that can help remind you. And so putting gloves on regularly is a really important thing, and should always be associated with hand washing. When you remove those gloves, you need to wash your hands right away as well.
Awesome. So eye protection, that would be another one of those four. Why is that so valuable?
Yeah, especially if you're going to be within 6 feet. The big danger that eye protection can mitigate is coughing and sneezing those particles right into your face. If you get some of those particles into your eyes, that can certainly cause an infection, and so that would be a concerning exposure. So the eye protection that you use, you want to have it be something that can protect you from splash and coughing. So typically we say your own eyeglasses are probably not sufficient. Certainly contact lenses won't offer any protection, but something that wraps around and will protect you from those coughed or sneezed particles.
So for like with eye protection, you know, our cops, you know, are issued a pair of eye protection, and they're wearing these things around all day, and they're touching them quite a bit. What's a good way to keep them clean?
Yeah. So, like you just said, touching them all day is certainly a way that your protective gear can start to become more of a hazard if you are touching them frequently. If you do that before you've washed your hands, you can contaminate those glasses and then touch them again after you've washed your hands, and that can become a source of infection. So washing them frequently is important, and that can be with things as simple as soap and running water, or with something that's virucidal, a bleach solution, or the wipes that we are constantly using to wash things. Any of those processes can be sufficient, but I'd encourage you to try to beat that habit of not touching your face or your glasses.
Excellent. Let's move on to gowns, and I think we've had the conversation, and it's not a secret, but gowns are one of those things right now that are nearly impossible to come by for law enforcement anyways. So one of the things we've done as a department is, we're now wearing long sleeves. Does that offer some good protection from potential virus?
Yeah, so the perfect level of protection would be something that's waterproof, that won't allow the particles to carry through. Your uniforms are not waterproof, but if you get coughed on or sneezed on, or you get some contamination directly on the uniform, that's certainly better than your bare skin, because like gloves, your uniform can then be removed and decontaminated. I'd still encourage you to wash below that if there was a contamination, especially if the uniform got wet. But certainly a long sleeve will offer more protection than just bare skin.
Awesome. So, and that leads us into the old raincoat, because that's our gown, and we're finding that it's a great option because it's an open front coat, which we train, so we can still get to our tools. We can cover up our tools as necessary,
Mm-hmm.
but then we can decon it, or just we can throw it in the wash and get it cleaned up. So waterproof, right? So a higher level of protection than just wearing our long sleeves.
Yeah. So if it's waterproof and not allowing those particles to get through with water, then it can be decontaminated, like you said, and should protect you a lot better than even just a uniform long sleeve shirt.
Awesome. Important to get those gloves up over those cuffs, though, even on that raincoat.
Yeah, I'd say so. And the other thing to keep in mind is, as we know, some of these scenarios, the bigger danger is going to be the subject that you're interacting with rather than the virus they may or may not be infected with.
Yeah.
So being able to get to your gear is important. And so if I were still working in the streets, I wouldn't want to put on the gowns like we were in the hospital for that reason. But having the coat, if you can keep it closed and not open it and complete your encounter, then of course your gear is not as likely to be contaminated. But even if it is, that's something that can be.
Well, I appreciate that, and I know that comes from you being in law enforcement. You get that.
Mm-hmm.
You know that we can be thrust into a situation where we have to be able to get to our tools, and like you said, again, and that's why I love having you here, is that, yeah, there's things out there that are more dangerous than just this virus that we still, are responsible for
Yeah.
in our personal safety and other people's safety. So thank you for bringing that up. Everybody's favorite conversation, right? And I don't need to make light of it, but it's been a big topic here in the last week or two, the old mask,
Yeah.
right? And we get into this thing where there's not an endless supply of N95, so we got to be careful in how we use them. But there's also when do we use it? You know, when should we be using it, and when maybe do we not need to have it on?
Yeah. Well, just like we talked about with the glasses earlier, wearing a mask all the time raises the risk that you're going to be touching the mask, especially if you're adjusting it periodically, touching the contaminated side of the mask, and that can actually lead to increased risk of infection. And so using your mask carefully and being sure not to touch the mask when you don't absolutely have to is an important part of this. But that's something that if I'm going to be encountering somebody in the hospital who's got symptoms or potential symptoms, I'll definitely be wearing a mask whenever I'm within that 6 feet boundary.
So let's talk about the surgical mask or the simple mask, and then compare that to an N95 mask. What are the differences there? What does the N95 protect us against that maybe that surgical mask may not?
Yeah, so the N95, you get fit tested for it, and it's been tested and proven not to allow particles above a certain size to be breathed in through the mask. So an N95 doesn't allow particles of the size of the coronavirus to pass through, which is why we can use that for protection, even in an environment where there might be a lot of coughing and sneezing and spitting and aerosolized particles. The simple surgical mask that we use, or the simple face mask that you might be using, has not gone through those same controls, and its purpose in most of its use is in the operating room to keep things I cough and sneeze out from getting onto the patient that is in the operating room. It's a surgical mask. So that means it's a really good thing for somebody to wear while they're symptomatic. So giving it to somebody who has symptoms can be a way of reducing everybody's exposure. But that's the same mask that I use when I'm interacting with patients when there's not a lot of aerosol generating things going on. So under a routine interaction, even in the emergency department, the mask I wear is the simple surgical mask, even when I'm within 6 feet, as long as I'm not doing a procedure that's likely to generate a lot of those smaller particles.
So that surgical mask, if we're wearing it, could help with some of those droplets.
Yeah.
But maybe not the smallest of smallest droplets.
Right, exactly. And we use the term aerosolized particles when we're talking about things where we would need to use that N95 level of protection. And for us in EMS and in the emergency department, that's things like ventilating with a bag valve mask, placing a breathing tube, and those sorts of things. And so those are the times where we're still trying to use the N95. If we had an unlimited supply of N95s, you could make the argument that we should put them on all the time when we're within 6 feet of somebody who might be symptomatic, but we know that that's not the case, and that's a supply that's become limited nationwide. And so we need to make smart decisions about when and how we use those if we're going to be able to conserve them for when we really do need them.
Right. So on our officers, if we are going to go into a situation where we have a known patient that has the virus, or reasons to believe, and those are those three big ones, right? What are those three again?
And so fever, cough, and shortness of breath are the big three symptoms.
So if we have someone symptomatic with those three, and or we have reason to believe they have COVID, that's when we're saying, hey, we want you to put that N95 on.
Yeah.
Okay.
Absolutely.
Well, that helps. That's great info. I have maybe a little bit of a side note question here, but with people that are contagious versus not contagious, and maybe I should rephrase that, and I'll say, if someone has symptoms like we just talked about, are they more contagious than someone that isn't necessarily showing us symptoms?
Yeah, somebody who has symptoms we think is very likely to be contagious, because part of the symptoms is being triggered by the production of extra virus in their body, and that's why they're shedding virus and spreading it when they have symptoms. When somebody doesn't have symptoms, and maybe they're in that period where they might be in the incubation period, have been exposed but not yet generating symptoms, we don't know for certain if they are contagious or not. But it's certainly less likely that they're contagious when they don't have symptoms. We think maybe up until the 12 hours before they get symptoms, some of the evidence is suggesting that's when they might become contagious, but it's not a certain thing. So when they have symptoms, I would say they're very likely to be contagious. When they don't, they're much less likely to be contagious.
Good stuff, Doc. I'd like to move into maybe just touching on a few different scenario situations, and then I think that'll be it. So I'll start with a scenario of where, as you know, a cop working out on the street, I don't have PPEs on, and I'm dealing with a person that has no symptoms, right? So they don't have fever or cough or difficult breathing, but I end up inside that 6-foot space, right? I'm out on a call, maybe I'm on a situation, and either I violate that 6 foot or someone else violates that 6 foot, or I gotta walk by somebody, but we don't have those symptoms. Would you consider that an exposure at that time?
I would not consider that an exposure. If the person does not have symptoms, even if you have close contact, I would not consider that an exposure. I'd still recommend that you do the normal standard type things, which is most importantly hand washing, and avoid touching your face whenever, throughout the day, regardless of whether you're having interactions.
All right. Let's try this one. This is the old, we get thrusted into action. We can't, I can't call a timeout and say, whoa, I gotta pull out my N95 and I gotta get gloved up here, right? Being a former cop, you're familiar with that. So we don't have the mask on, and we end up going hands-on with a person, and this person, in fact, we find out is feverish. They are exhibiting those signs. Would that be considered an exposure?
Yeah, I would consider that an exposure. And if that sort of thing were to happen to one of your officers, the things that I'd recommend are to keep in mind how the virus is spread. And like I said before, if you get it on your skin, that doesn't mean that you're infected. You got to wash that off. It's when you start touching your face and those sorts of times that you really need to worry about that. So I would encourage things like hand washing immediately, thorough decontamination of anything that might be contaminated, uniform, belt, and duty gear, and all of those sorts of things to make sure that everything is cleaned and decontaminated. And then watch yourself for symptoms over the period of the next couple of weeks.
And we have a reporting process for that. You bring up a good point with that decon. We have established now down in our Southwest team a decontamination site, which has locker rooms and trash bags and place to wash duty gear and take off items that we believe have been contaminated and get them in a bag and get them into a laundry service that handles hazmat stuff.
Yep.
So we're ramping that up for exactly a scenario just like we described here. So,
yeah, that's sounds like an excellent process.
All right, I got a couple more, and then I'll let you off the hook. Full PPE. So I got on all four. The person has symptoms, and it's obvious to us that they have symptoms, and maybe we know they're COVID-19 positive. And in this scenario, we go hands-on, and with a person. Now, Doc, I'm touching somebody with COVID, but I got the 4 on. Where are we at there with an exposure?
Yeah, so I would not consider that an exposure as long as your gear hasn't failed. We know that glasses, masks, these sorts of things can become dislodged during a fight, and if that happens, then maybe it would be an exposure. But if those pieces of gear have not failed you, and you're meticulous with your decontamination, then I would not consider that an exposure. It'd be a great time to work together and watch each other as you're taking off gloves, taking off that raincoat to make sure you don't cross-contaminate yourself. But if those pieces of equipment are on and don't fail, then I would not consider that an exposure.
Good stuff. Thank you. Last one. It's learned that the person is infected and it's obvious, right? One of those scenarios. We have no PPEs donned. But in this scenario, we're clearly outside that 6-foot zone. So maybe we enter a room where we know there's a COVID patient, what have you, but we clearly stay outside that 6-foot area and remain outside that 6-foot area. Would that be considered an exposure?
I would not consider that an exposure, with the important caveat that you might be touching the same surfaces in that environment that have been coughed on or that that subject has touched. And in that case, it's still possible for you to touch that, then touch your face and be exposed. And so this is where we just have to get back into the meticulous hand washing and or wearing gloves whenever you're interacting in an environment.
So, cops, it's a tough job. We have a very, very difficult job, and this whole COVID-19 thing has just added a whole nother level of complexity to what we do. But what I'm hearing to say is we got some good tools that if we get into some really good habits in using them, we can really help ourselves out and increase our chances of not getting infected. No guarantees, right? And like you said, this stuff is changing. Oh my word, it's changing every 5 minutes for everybody. But I'll be honest, one of the things that really hasn't changed in the last, for quite a while now, is those basics.
Yeah.
Those basic 4 PPEs are staying pretty solid. And everything you've described has been on point. So we stay smart, we can really help mitigate that and improve our odds. So I gotta tell you, I so appreciate you coming in. You being a subject matter expert, and then also having a cop background really helps me, and I know it's going to help our officers, and just kind of that straight talk, and we're not getting it from 20 other sources. Hearing it from you really helps us out. So I'd shake your hand, but
That'd be a bad example.
yeah, thanks for coming in.
Absolutely, glad to do it. If you have any other questions, let me know. But from what I've seen, you guys are doing a great job of preparing as best we can in these tough circumstances.
Thanks, Scott.
Absolutely.